The Uganda Professional Drivers Network established the Truckers Wellness Center at Nateete to provide healthy services to long-distance truck drivers, a group considered highly vulnerable to HIV/AIDS.
We have been able to, as ourselves, put in resources to even meet the standards of government, to register a formal clinic. We are working with the government of Uganda through Chitebi Health Center 3, Kawala Health Center 4, and all this to ensure that the clients that come out of our facility, the ones we can treat, we treat. The ones we cannot treat, we have a motorcycle to deliver them to the hospital. The
proprietors of the Wellness Center explain that Nateete was strategically chosen due to its location along major transport routes and its high concentration of mobile populations.
We saw that there was a demand, and the statistics that we had, that whenever there is a truck driver, there are female sex workers, and the customers are the truck drivers. So through HIV programs, extending health services to the truck drivers, we saw that there was a gap, that also we had to engage the female sex workers also on board.
Nateete is a high-risk area with a significant presence of sex workers and trucker stops.
We are trying to design this model, for example, that we are having a lab technician on ground, we have the clinician, and the secret behind that, if someone is tested and turns positive, this very person is being given a confirmatory test from here, other than referring him to the facility because of the time. And after confirming that this person has turned into is a positive client, is enrolled on ART.
The Drivers Network is seeking partners to expand affordable health services given the high cost of medical care.
There are gaps, and we are calling for those of you watching us out there and seeing us that we need you to support us, because to serve a community where you're having over 100 people enrolled on PrEP, over 10 new HIV positive cases. We have worked in those places. You have seen in areas like Mabito and in those truck parks, the number of people, the hotspots, the drug use, the demand is much. So
the Uganda AIDS Commission has plans to integrate such community-based models into national HIV/AIDS policy frameworks.
Looking forward to working with them to have this model replicated in almost all the stops within the country, in all the towns, because there are so many high-risk people who live around these truckers and where they stop.
The wellness facility has opened up its services to the wider community and is appealing to the stakeholders to support service expansion.
We call upon support for areas of medication, for example, because now when we test somebody urinalysis for free and they have STI, and STI is one of the biggest problems in these places. The medicine we have, we are telling them to pay. No, that one we cannot subsidize medicine. Is it possible that somebody can say, okay, for me I'm only supporting the STI medication. For me I'm supporting furniture for that place. For me I'm supporting computers. For me I'm supporting health workers who can work in the night. This is the kind of support we are asking, and not necessarily really money.
The Uganda Professional Drivers Network also guided development partners on a tour of the Nateete locality to highlight the scale of the challenge and identify areas for intervention. LUBWAMA and REAGAN for UBC.